we all have to make those choices. I know I made my choice last week with my financial person. Of course, I'm Medicare. For those of you that might not realize that I'm of Medicare age, but I'm sure you do. My hair gives me away. Today, our guest is actually the founder of Catch, Kristen Anderson, and she's going to be the best person to talk with all of us today, including me, about their offerings and the potential benefits to NCCA members. But before we bring on Kristen, I would like to take a moment with all of you. Somebody's driving and needs to mute, please. Thank you. That happens to me periodically. Before we bring on Kristen, I would like to take a moment with all of you to provide some insight and reflection to where the childcare industry is going as it pertains to funding at this moment. Some of you, are probably keeping up with a lot of the events that are happening in Congress. But there hasn't been a lot of information put forth about what's going to happen with childcare and how childcare is going to be supported in funding or in the 2021 budget. So I'm not going to go into great detail, but I will give you a little bit of a summary. First of all, there's nothing solid on the table right now as it pertains to more COVID-19 relief funds. Now, yes, there are bills. There's the $50 billion bill that was passed in the House a while back, but there haven't been any real negotiations in the Senate that promotes that bill. There's also a bill called the HEROES Act that was passed in the House several months ago, and it would give some relief to childcare. Similar to what we received in the CARES Act. But again, the Senate has really done nothing but counter a stimulus bill that would offer very little and really practically nothing to childcare. Unfortunately, Congress is distracted with all the current events. And while the Democrats put forth bills, they are not usually willing to negotiate at all. And while I try to keep our conversations bipartisan, I mean, it's fair to say that it would really be nice if both parties would get over themselves and really talk for the benefit of their constituents. And I have some ideas for that I'll continue to throw out to you all. Nothing really new, but as far as the actual fiscal year 21 budget, which is typically approved by now. It's gone through the appropriations process in the Senate. But because of all the distractions, COVID, the election, several things that, have really kept everybody moving, in different directions. The appropriations, those bills have not, gone through yet. Right now, early childhood is set to receive the same dollar amount that they received last year, which was $20.92 billion. And that, of course, is divided up into the mandatory spending for childcare entitlements to states, the Child Care Development Block Grant, and Head Start. And the bottom line on that is we're not going to be able to serve more children. There are still approximately 1 in 6 children. There's approximately 1 in 6 children that qualify for childcare funding that never receive it. And that's because there's not enough of it. So really not a lot to, at this point to, celebrate. What does this mean for childcare providers, educators, parents, the economy, and most of all, children? Well, first of all, we're going to see more childcare centers and family childcare homes that are licensed continue to go out of business as COVID continues to get worse and businesses are forced to shut down again. I think that's the biggest fear right now, is that some states are starting to shut down again, Maryland, Chicago, Illinois. And when that happens, you know, people either get laid off or more of them are back in their homes working. And so there is a concern that this will have a really long-term effect on having children in licensed childcare situations. And that could be a consequence, you know, as things return to what will be a new normal, but I am convinced that we will move past COVID at some point in our lives. But when we do get to that, we're going to see more children that have probably had delayed experiences in their early learning situation because they've had to go into unlicensed situations for their care and education. And I'm not saying that all unlicensed situations aren't healthy, but at the same time, they're not monitored, and there really is no way of tracking, you know, what it is they're doing or receiving in their care and early education. When COVID gets under control and people are back to work in full force, business owners are going to struggle to get the employees they need due to lack of childcare spaces. It's going to keep more women out of the workforce, and ultimately that's not good for, you know, businesses, not just childcare, but businesses in general, you know, to flourish if they can't serve their customers. I think the bottom line for childcare is that we've been underfunded for years and years. And I think we need to remember that this includes when we've had both Democrat and Republican presidents. And while, you know, I think there's some hope with a Democratic president that we will be more at the forefront, and Joe Biden did write a great childcare plan. The reality is Congress holds the purse strings. And while the Democrats in theory want to do more, they're not always wanting to negotiate and do what needs to be done to get to, you know, an agreement that everyone, you know, can live with, and where early childhood education can prosper. And more than anything, we as small business owners and educators and providers aren't really given the opportunity to work with those individuals, that, you know, help show them and share with them our expertise, which is a big role of the NCCA and our memberships. We have volumes of research from reputable people and organizations that tell us we must have better trained and better paid staff to do what's best for children. That information is all over the Hill. It's there and available. We have great organizations like NACCE and First Focus and many different organizations that have researched this and put in writing what is needed for young children. And it all goes back to taking care of the people that take care of the children, whether you're an owner provider or you are an educator. And ultimately, we're never going to get to that point if we can't interest our Congress in providing more funding to our industry for the children that live in poverty or near poverty, because our lower middle income people really struggle to afford quality early childhood. And owners can't do more than they're doing because they too have to make a living and survive. So the other thing so we need increased funding in the Child Care Block Grant. We also need tax credits for our paying parents. Childcare, again, the research is out there. Childcare is becoming unaffordable to many of our middle income families. And tax credits are really, for lack of a better phrase, it's just a no-brainer. And we're going to have to push that more in our NCCA agenda moving forward, and we will. So bottom line, what can you do? If you're listening and you are, you know, part of this webinar, but not part of NCCA, the first thing I would tell you to do is join NCCA. And then receive our emails and newsletters and read them. And then when we give you the opportunity to easily participate in an action alert to your US legislator, your congressman, your representative, your congresswoman, participate and make sure that your particular, state's US legislator knows what you expect. And yes, sometimes they ignore us, but don't give up. Keep shooting that email, keep making that phone call, and keep letting them know who's calling and why. If we honestly could get the millions of providers, educators, and parents that depend on this industry to be a voice, our voice would count much more than the money that lobbyists pay, to get the actions they need for big business. I always think about the NRA. The NRA, is a powerful lobby. And that's because the drug companies, they're all powerful lobbies because they have tons of money. That's never going to be us. So we need to have tons of voice. So if you're not a member, join. If you are, read your emails and action alerts. We have not put any out in the last 6 to 8 weeks because, again, the organizations that we work with that actually put that together and help us with are not, have kind of ceased for a little bit while we've let the election occur and now the transition. But be ready to do this in full force starting in January. And also when your legislators are in town, because your US legislators take breaks from Washington, make an appointment with them in their office. You're a voter. You're their constituent. They're who they are. So you are who they are supposed to, pay attention to. And right now, they're not really paying close attention. But I do believe it's because they don't hear from enough of us. But again, thank you all for what you do. You work hard. You are essential. And never, ever let anybody make you feel less than, because you are the reason. You are basically the only reason millions of people get to go to work every day. And never, ever forget that. And of course, the difference you make to spending time with young children and helping them develop, along their journey as a young child. So I'm going to turn this over now to Kristen. And hopefully there'll be something that Kristen talks to you about today that will be helpful to you.
Awesome.
Kristen?
Thank you, Cindy. Thank you so much. And just to echo that, thank you all for all the work that you do. I am not a mother myself, at least not yet, but I have plenty of our team members who have children, plenty of family members who have small children, and I know that this is the most important job that anyone can have. So my talk today is going to be a little bit about what we at Catch do broadly, but focusing especially in on health insurance because it is open enrollment right now. So now is the time you can get health insurance for 2021. But I'll start with just telling you a little bit more about us and sort of what we do as a company. So if you've worked at other companies before, sort of more traditional work, you have what's called a W-2. That's the thing that your employer gives you. That's what your pay stub comes from. Your taxes get paid out of that. Retirement comes out of that. Health insurance often comes from your employer. And that's how like 200 million Americans are earning income right now. But what you all know and what we saw at Catch was that there's sort of a large and growing number of people who are working independently. So they're starting their own businesses, they're self-employed, they're doing a variety of different things that mean that benefits don't come with their paycheck, right? So they're left answering these questions on their own. How do you take care of estimated taxes? How do you make sure you stay on track for retirement? And obviously this time of year, how do you make sure you get health insurance for you and your family? And so that's what we set out to solve for the 57 million independent workers. That obviously represents a broad base from childcare caregivers to small business owners and designers and photographers and actors and all sorts of different people who all share this same problem of needing to figure out their own taxes, retirement, and health insurance. So we created Catch. It is a technology platform. It is available on the computer or on your phone through an app on Android and on iPhone. And it takes care of a number of different things for you, right? It gives you one place to really manage those critical benefits, because what we know is that you don't really want to think about that all the time, right? Like every time you're getting paid, you don't want to think about your taxes. You don't want to be thinking about retirement. You want stuff to just work on your behalf. So we created Catch to do automatic tax withholding. So if you're an independent or you're receiving a 1099, we can automatically set aside money so that when it's time to pay the IRS each quarter, that money is ready to go. We can help you invest for the future with retirement to make sure you have money that's growing over time. Obviously, we know that that's really important. And then finally, giving you access to these really high quality health insurance plans. And that's what we're going to spend most of our time talking about today. So just a quick look at like what that looks like and how it works is on the broader platform. So when you're setting up these benefits for yourself, you will connect your bank account. So you don't have to get a new bank account. Let's say you have a Bank of America account. Let's say you have a Chase account. You can connect that right to our system. Choose the benefits that you want. We don't force you into anything. You can choose to set aside money for time off. You can set aside money for emergency savings. You can also like create your own goals. So if you want to save for a specific vacation or a certain outfit or something like that, you can create those savings goals too. And we'll help you figure out how much you should be setting aside of each paycheck. So if you're not necessarily earning the same amount every week, if there's some fluctuation or some volatility in your income, we can help make sure that we're setting aside so that you'll still hit those goals regardless of how your income might be changing over time. And then like each time you get paid, you'll sort of have that paycheck come in and we'll just say like, all right, we're going to set aside for these things, and you have control over the entire process. So again, the goal is to make it easy. The goal is to use technology to just take this off your plate, right? This is just one more thing that you don't want to have to think about, and one more thing that you can just have working in the background so that you can focus on the really important work that you do every day. Oh, sorry, clicked the wrong button. Not sure which button I clicked. One moment. Thanks for your patience.
If there's ever a group of people that have patience, my guess is it's you all.
That's a great point. This is Noelle, by the way. She's on my team, so she's here helping us out. What you can see in the background actually is our product. So this is sort of once you have it set up, what it looks like. Like we're running a little slow today. Extra Zoom pressure. All right, so let's just jump right to where we were. Awesome. So like I said, this is that paycheck view. Each time you get paid from however you're being paid, if individual families are paying you on their own, you can receive each of those checks and we can do that same process to them. So it all happens in an app. It all happens instantly. It's very easy. And then the cost for it is $1 a month to have it set up to be automated. So we've really tried to make it affordable and accessible so that it's something you can access, regardless of how much income you're making. So let's talk a little bit more about health insurance and what we're offering here. The United States is different than every country in the world. There's no other country that does health insurance the way that we do. And we actually work with a number of different systems. So the health insurance that we offer at Catch is for individuals. And every plan that you will see on Catch is what's called ACA compliant. So ACA is the Affordable Care Act, that's Obamacare. Every plan that's on our platform is compliant with Obamacare. And what that means is that it meets certain requirements and quality because, I mean, you may have seen this. There are new products coming out. It's unclear like what they are. It's unclear what they cover. It's not like some of them aren't even insurance. And so we've done a lot of the work up front to make sure that we have a bunch of plans that are available that are all ACA compliant. So let's make sure I don't accidentally exit again. So the health system that we have is split in a number of different ways. So for income, you are actually on Medicaid. So sorry, that's the wrong word. Income is actually Medicaid. So based on how much you make, if you make less than a certain amount in your state, you qualify for Medicaid. And then if you are working a certain way, you might qualify for employer-sponsored coverage. If you're a certain age, you qualify for Medicare, or your children might qualify for CHIP. And if you have veteran status, you might qualify for TRICARE or be able to get healthcare through the VA. So all of this is just to show you we have so many different systems working at the same time that if you're confused about what type of health insurance you need, you're not alone. There are way too many choices. There are way too many options. And some of these things are your choice and some of them aren't your choice. And, you know, depending on just like where you might be living, you have different access to different things. And so our goal is to kind of help clarify that. So one thing I'll say up front is that we do have a team of really talented and highly trained agents who can help you answer some of these questions. Like if you don't even know if you're qualified for health insurance right now, that's one of the first things that we can help you sort through if this is something that should be working for you or not. So what's left is that after all those things, after employer-sponsored care, Medicare, Medicaid, CHIP, veteran status, what about everybody else, right? And so I think the types of people we serve, like I mentioned, hairstylists, photographers, caregivers, like you don't have the same sort of system built in place for you. And so you're often left finding coverage on your own. And that is where the ACA actually made a lot of progress, was providing access to health insurance for independent and individual families. So there are two different things that came out of that. You basically have the federal marketplace, which is run by the US government and the Center for Medicare and Medicaid Services. And then you have state marketplaces. So the ACA gave states an option to create their own marketplace. So if you live in one of these states, you are technically in a marketplace, but it's just for people in your state. There's not really any functional difference. They just sort of use a different technology system, excuse me, and how they offer plans to you. What these marketplaces do is they bring together a bunch of different competing insurance carriers to help you see all of those options in one place. It's a much better alternative for you having to like go to Blue Cross and then go to Ambetter and then go to Oscar and look at each of those plans individually and try and decide which one is right for you. This is a technology that brings those all together for all the plans that you're qualified for. The other thing that's really important about the Affordable Care Act is it also provides access to tax credits. So Cindy was kind of talking about some of those tax credits for childcare. Well, there are tax credits for health insurance for independents as well. So if you make less than, I think this year, it varies a little bit based on your family size, but less than about $52,000 a year, you qualify for tax credits on your health insurance. So that's something that can absolutely help lower those costs for you, and Catch helps you apply for those tax credits directly through our platform. So you don't have to worry about finding it later. You don't have to worry about filling out extra paperwork. We do all of that directly in our system, so that the amount that you're paying for health insurance is the absolute lowest price that we can get for that. And then the final thing that I mentioned, some of the standards. Every plan we offer covers what's called an essential health benefit. So these are the 10 essential health benefits that Obamacare put into law. And to be compliant, a plan has to cover all 10 of these different things. So if you hear about some of these alternative health insurance, it's not that any of them are necessarily good or bad, but it's important to know that they may not cover some of these things, right? So make sure you're aware of the things that those plans are offering and where some of those deficiency might be. For example, some of these alternative plans don't have any maternity or newborn care at all. Some of them don't offer any coverage for hospitalization. So you might think you're getting a really great deal, and then if something happens and you need to go to the hospital, you're paying 100% out of pocket. So these essential health benefits are what's considered like a government approved major medical health insurance plan, and that's everything that you will see on our platform. So again, I mentioned it a little bit at the beginning, but what is open enrollment and why is everyone bugging me about it? Open enrollment is the one time a year that you enroll in coverage for the following year. So basically to help insurance companies manage risk, the concern is that if people could buy health insurance anytime, people would only buy it when they were sick or when they thought they were sick or when they thought they might need it. So they create this small window where people can enroll in health insurance plans to help sort of de-risk that process. So between November 1st and December 15th, those are the federal deadlines. They vary a little bit by state. I think California extends to the end of January. Here in Massachusetts, where I am, I think it's mid-January, so it varies a little bit, but December 15th is a good deadline to kind of have in your mind of when that process ends. So you need to enroll in your plan at that point so that you have coverage for 2021. There are some exceptions if you move, if you have a child, if you, what are some of the other ones, Noelle? There's a whole bunch of different like special cases. If you get married, if you have traditional employment and coverage from an employer and then you lose your job, those are things that can qualify you for what's called a special enrollment, which means you can get coverage during the year. But if none of those things happen and you're just sort of like you're an independent childcare provider, you've been an independent childcare provider, now is the time that you want to purchase that plan for next year. So a few definitions. What I would say is the thing to take away is talk to an agent. The agents, at least at Catch, are not paid commission. We are here to help make sure you understand the process. They're not earning based on which plan you choose. There are a lot of different vocabulary pieces to know when you're sort of comparing health insurance plans, but these are some of the key concepts. So the first is the premium, which everyone kind of knows. That's the amount that you pay each month in order to get health insurance. That can vary based on your age and your income and those sorts of things. The deductible is sort of the second most important pricing piece. That's the amount of money that you have to pay before your insurance company starts covering some of your costs. So if you see like $1,000 deductible, some of them are high this year, $5,000, $6,000 deductible, that's the amount of money that you will have to pay before insurance starts covering costs. That's a bit of a tricky definition because, big surprise, the insurance companies make it kind of hard to know exactly what that means. Often they will cover things before that. Prescriptions, preventive care, all of those regular doctor appointments that you have, those are not counted towards your deductible. Those are a little bit separate. Co-insurance is the amount you split with your insurance provider once you've reached your deductible before you're at your out-of-pocket max. The copay is the amount that you pay when you sort of reach your doctor, like you go to see a dermatologist or your primary care physician. They ask for $25 up front. That's called a copay. And then the out-of-pocket max is the most money that you have to pay towards your own healthcare before insurance covers everything. There is a federal limit on that for all ACA compliant plans. I think that number right now, we can correct this, I believe it's about $8,200 for an individual and about $16,400 for a family. So that's sort of the ultimate cap, and it has to be lower than that. So it can be lower than that, but that's the amount that the government says it must be lower than. A couple tips for caregivers, so just some important things that you should know. If you are self-employed, the premiums that you pay are tax deductible. So that's really important. That can get you a huge discount on your taxes when you're paying those. All the money you're paying towards your health insurance premiums can count towards tax deductions. Dental and vision is also available right now when you enroll in health insurance. So those are often much less expensive than what you're paying for health insurance. So you can get all of that coverage at one. I think vision plans typically cost like $8 to $10 a month. They're usually pretty affordable. So if you need vision care, that's a good time to get that as well. Nationally, 9 out of 10 people qualify for tax credits. So there's in the process, it'll ask if you want to apply for tax credits and savings. Don't say no, say yes to that. Make sure you're saying yes. Make sure you're seeing if those savings are available for you, because they can help lower those costs really dramatically. I think the average cost savings that Catch got our users last year was $511 in tax credits a month. $511 a month in tax credits. So it's a really significant amount that we can lower costs, but you have to go through a bit more question and answer to make sure you get those, but it is absolutely worth it to do. And then finally, again, those tax credits can be so helpful that 7 million people right now are actually qualified for a plan with a $0 premium. So make sure you're going through that process to find those credits, because there are a lot of people who can get a plan where they pay $0 each month. So if you're earning in the 20 to 30K range each year, there's a good chance you might qualify for one of those plans. Or what we often see sometimes is that you could find a plan for $0, but the deductible is really high. So maybe it doesn't seem like a great deal for you. And there might be a plan where it's like $20 or $30 a month, but the deductible is a lot lower. So we can help you look at those options and try and balance those things out. And it may be better to pay $20 up front each month in order to have that deductible lower. But again, our agents can help you sort through that. Our users think our product is really easy. We offer all of the same plans that you would get from healthcare.gov. So if you were going to go through the government website, you would see a list of plans, you would see everything there. But the government website maybe isn't that easy to use. It's not very clear. There are lots of things that don't really make sense. What is better about our system, at least if you ask me, is that we have people who are there to help you, and we built the flow directly with people in mind, right? We didn't build this as a government system or a bureaucracy or based on law. We built this based on people. And so we're here to help you get through that process in a much easier way. The cost to use our health insurance system is free. So you don't have to pay anything for it. We get paid by the insurance company. So only if you decide to enroll in a plan, and then the insurance company pays us. So if you enroll in a plan with Oscar or Blue Cross will pay us for that, and you don't have to worry about that cost at all. So we built this system with the goal of like helping people find the best plans. And I mentioned it earlier, but we do think we're fairly unique in that we don't actually pay commissions. So no one on our team is trying to force you into the plan that we make the most money off of. We're just trying to find you the best plan, and everyone like wins in that world. That's what we think is the most successful way forward. So I wanted to do just like a quick walkthrough of what our Health Explorer looks like, just so you can get a sense of what it is and see what those questions are and just sort of see how it works. And then from there, we can make sure that everyone on the webinar has access to a link. So we have a link with the NCCA where you can actually go through and do this yourself, talk to our agents real time and sort of do that. So I'm going to do that demo really quickly. So here's your page. Again, we've got this awesome partnership with NCCA. You can come and you can find health insurance. Let me just get this out of the way. And then let's go ahead and go through what it might look like if you were looking for plans right now. So I've entered in a zip code here for Austin, Texas. So if we're looking for coverage for 2021. You can look for coverage for the rest of this year too, but you will have to qualify for that special enrollment. So we're seeing most folks right now are looking for 2021 coverage. You can enter your household income. Let's say it's $35,000 a year and it's me at age 30, and let's add a child who is 4. We can go through and estimate savings. There it is. So I can save $206 a month. Plus I have access to bonus savings if I choose a silver plan. So there's some quirky things in the legislation. It's not that important to know all the details, but if you see this bonus savings thing, it means that you qualify for extra savings on silver plans, but you'll see that in all the costs. So now we can go through and we can help get recommendations. So the goal here is to help you find a plan that makes the most sense for you. So first it's about like, do you want to pay the lowest out of pocket each month, or do you want to have the lowest deductible? Those are kind of the trade-offs that people tend to make. So let's say that we're looking for a low premium. How often will you need healthcare next year? So are you just looking for preventive care, or do you have some prescriptions that you know you're going to need, or do you have chronic care that you're going to need? So let's just say sometimes I have some prescriptions and regular doctor's visits. I can enter in doctors' names of doctors that I want to keep on my plan. I don't happen to know any in Austin, Texas off the top of my head, but you can search all your doctors here. There's got to be a Dr. Smith, right? Let's go ahead and say, let's do this one. All right, so we've added a doctor to our plan, so you can enter in all your doctors there. Prescriptions that you might need. So let's say there's birth control. You can add that to your plan. And then it's loading. It's loading. Okay, so this is the recommendation. So this plan is not accepted by that doctor. I don't actually know who that doctor is, so it's quite possible he's not the right fit for these sorts of plans. But you can also see which ones I can use bonus savings on versus not. So this is the plan that we recommend, but we can also show you other plans as well. So this one matches all of your needs. So it's a gold plan. That doctor is accepted here. You can see all the pricing here. And then we can also see, oh, like if I wanted a lower price plan, maybe I need a little bit less coverage, or I'm not so worried about my doctor being covered. I can see all those plan details. So all that information is here. You can copy a link to this. You can email it to yourself. You can email it to your partner. You can share all the details so you can get a better look at it. Make sure that you can look at some of the things around like treatment and services, like what it costs for generic drugs and things like that. And then you can start the enrollment process. So if you want to pick this plan and get health insurance here, you can just click enroll in this plan. So that is the basic process. I think the main thing that we want to share is like, there is a lot here. There is a lot to sort through. There is a lot to manage, but we have built a system that we feel really confident can help people make these choices better. We've tried to set up the entire system so that it just like answers the questions you're going to have. Again, prescriptions, the doctors you need, those sorts of things. But we do have a team that's available for help as well if you want to chat into any of our agents at any time. So I'm going to go ahead. I'm going to stop sharing my screen so I can look at all of you. I can pull it back up if I need it. But let me just go ahead and see everyone, because I've been staring at myself this whole time. So I'll just pause there. I'm sure there are probably questions. I'm happy to answer any of those. I'm not sure if we got any in earlier that we want to answer. If we just want to ask now, I'm happy to take them live.
Kristen, we did get one. I sent it over to you. If you could read that real quick and address, I think that if you could read the question and then answer, that would be amazing.
You sent it to me in the chat.
I can just read it. If I'm a low wage earner and my employer offers health insurance that I cannot afford, can I go through the marketplace to get insurance?
Yes.
Example, I make $11 an hour. To get insurance through my employer, I have to pay $250 a month, my share. I cannot afford this. I can most likely get it cheaper through the marketplace. Can I do this?
Yeah, great question. So our application process will help you sort through. There's not usually like a black and white answer because it depends on exactly what your annual salary is going to be versus what the costs are from your employer, but we can help you sort through that so you can see. My guess is, this is a loose guess just based on that information, is that you will probably qualify for marketplace coverage because there is a standard of affordability, and if the care that your employer is offering is not affordable, you can get coverage through the marketplace. So that would be my initial guess, but again, it will depend a little bit. It also depends on what state you're in, unfortunately, but we can help you sort through that because all of that will come through, and it'll help you see those marketplace plans if you're qualified. By the way, our system will also tell you if you're qualified for Medicaid. So if you're not sure if you need independent coverage and you go through and you enter your information, we'll tell you if you qualify for Medicaid, and we can help point you to the state resource to help get you enrolled in that. So that's another thing to have as well.
Okay, anyone, if you have any other questions, this is definitely the time. We've got 20 minutes left. If everybody wants to just ask Kristen directly, all you have to do is take yourself off unmute. And by doing that, you just scroll over either the bottom and hit unmute, or on your picture and hit unmute.
I have a question.
Sure.
One of our employees, her husband is on which Social Security. Does his income count on her income?
Yes, it will be household income that's counted towards those tax credits. But it also counts towards household size. So the way that she would answer those questions is she would say, let's just say household of size 2, our combined income is, let's say, $40,000 a year, and then it'll actually ask to break it down. And so they do look at Social Security income on that. And I'm not sure if they treat it differently, but you can delineate it, and our system works directly with the government. And so if that income is counted differently, it will recognize that right away.
Okay.
Yeah. The key is just to report it, and then it'll come back with the tax credits.
So if I want four employees to participate, can we do 4, or do they all need to enroll individually?
Yeah, great plan. So you can do it a couple different ways. So I'm not sure if you've looked into group insurance options previously, but they're typically very expensive. And so what we've seen some small businesses do, because a lot of our customers are small business owners, is what they'll do is they'll sort of work out an amount that they're willing to help cover. And they'll say, hey, we can give you $50 a month, or we can give you, whatever it is to help with that. And then you can sort of say, here's the marketplace, you can find whatever plan you want. That's your choice. These are individual plans, so it wouldn't be like the same plan for all 4. Like they would be able to pick whichever plan is best for them. And so they can kind of look into that. You can also send them to the marketplace independently without any subsidy. That's absolutely a choice, or not, depending on what your financial position is. But you can also just say, here's a resource for you to use. We work with a number of restaurants. I think we have some in Maryland and some in Florida and some in Georgia, where they just say hey, we can't offer you health insurance. We're not able to do that, but here's a resource that can help you find those plans. And so they can just absolutely go through it on their own.
Hi, Kristen, it's Nancy Thompson. I have a small business, a childcare business, and it's in Southampton, Pennsylvania.
Mhm.
And I was told by my accountant that I was not permitted to put any money toward their insurance.
Yeah, there's something called a QSEHRA. Noel can correct me if that's wrong. It's called a K-SARA or something. It's a vehicle that allows you to do that. A lot of people will opt not to. We also just know sort of anecdotally that some folks are doing it without the sort of proper legal venue. You can just say like, we will pay you a $50 bonus each week. I think that some of those things are happening, but there is a legal vehicle called a qualified self-employed health reimbursement agreement. That's all the letters. And so there is a way to kind of offer that in. But I think those are still kind of in their early days. I know that was actually released in 2020. It was like the last part of the Affordable Care Act to actually get through.
So what would that mean to me? Like I could give it to as a bonus, but I wouldn't be able to say it was a healthcare benefit.
Yeah,
Is that what it would be?
that's typically what we've seen. Again, sort of the like folks who want to be able to offer something, but they aren't able to cover the whole cost, and they want to make sure it's fair across employees because again, costs can vary depending on people's age and income. And so that's what we've seen. Again, that's not like the official pathway, but we know a lot of small business owners are doing that because the cost of full coverage is just not really tenable.
Yeah, I mean, I know I've been trying to do this for years, trying to figure out how to do it, but yours sounds like you would have people there that would help the person know, because I had a couple of people on the Obama. I'm going to explain the situation that I had. They were on the Obamacare, and I was putting money toward that. Like I think at that point when it first started, I was putting half.
Mm-hmm.
Then that's when the accountant came in and he said, no, you can't do that. You have to, you increase their pay in order for them to pay for it. Okay, so I went ahead and I did that. What happened the next year, of course, now they pay more for the Obamacare because I put their pay up.
Exactly.
It seems like a catch-22 here.
Mm-hmm.
So then when the pandemic came, I took them off because he keeps saying that I'm doing this illegally. So I get kind of nervous.
Yeah.
I've tried to do the group insurance. It's very high.
Yeah.
It's very high. And nobody here is making that's $52,000 a year. So if they were to call you individually,
Mm-hmm.
it seems like the older people are paying a lot more.
Yes.
Under this new Pensy, because we're in Pennsylvania.
Mm-hmm.
Okay, so I know that one of the girls went on and they wanted, and she, I believe is, I would say 50.
Mm-hmm.
So hers would be like $450 a month.
Mm-hmm.
Like that's a lot. I mean, for her, there's no way on her salary that she could do that.
Yeah.
So, but I don't know whether that was, I just asked her because you were talking about it. And I said to her, did they say, like when you did that, how much the reduction would be? And she said she didn't know. But with the way you had it on your screen, it looks like that would show you right away.
Yeah. And again, it depends on how much she's making, but we can quickly kind of help see what those savings look like. I know Pennsylvania is a little strange this year because you guys just migrated over to the state marketplace.
Yes. Yeah.
But I think they should be able to offer what those cost savings are. The other thing, just sort of a catch doesn't do this yet. Again, I hope we will be able to in the future. But the other thing is that there are ways to sort of optimize because the income that you're reporting is your modified adjusted gross income. It's called an MAGI. It's like a certain line on your tax form. It's not necessarily your total income. So modified adjusted gross income means that there are certain deductions that you can take out of that. So one of the things we've seen is that like, can we help people into the right retirement vehicles? So if she can put a larger portion of her paycheck into a certain type of retirement account, she can lower that modified adjusted gross income and get those savings up for health insurance.
Okay, and you would be, because we do have something here called a simple, which
yeah, you have the simple 401k.
Right, yes.
Yeah, we don't have that built into the platform right now. I mean, I'm happy to pull a couple articles on it, but that is something where there's sort of a balance of like, if she can sort of maximize as much as she can put in there, then that kind of comes off of the amount that she'd be reporting as her income.
Okay, and then how do we get in touch with you? Do we go on a website, you know, like Catch, CATCH? Do you put anything else in there? Like,
Yeah, so
elsewhere?
we're catch.co, and the health insurance one is there. Pennsylvania is a little bit strange, so I'm going to take a look for you and see if I can find any agents in Pennsylvania that I know of, because I think this might be something that requires a human touch. Unfortunately, we can't code all of it away yet.
Right. Okay.
I'm going to take a look for Pennsylvania and see what I see. We might have someone on our team.
And Nancy, may I make a suggestion to
Sure.
send your contact information directly to Kristen so that she can communicate with you after?
Okay, I'm not sure how I do that. Do I do that in the chat?
Yep, exactly. You just go to the bottom and you hit the chat button. And then frankly, you could probably even just go and click on her face, and in the 3 buttons in the top right corner of her face,
Okay, got it.
you click it and you hit chat, and then it'll go directly to her. Yeah,
You can
good
just
question.
Send me your email. I'm not sure if I can post mine.
I didn't know.
In fact, Kristen, if you want to send out the best contact information for all of the attendees today in the group chat to all, that would be amazing, because then they can get with you directly with any questions, if that's okay.
Yeah, for sure. Yeah, we can definitely help with that. Again, I will clarify that we specialize in individual insurance, so we can kind of help you answer some of these questions for business, but ultimately the plans we're selling, they're not group plans, like they're for individuals. But we can help you sort through some of that stuff of like where, at least who you should be talking to about this. Because I know with some of those, like, especially we've had some clients in their 50s where they start to see those plans like getting really, really pricey. We can help on the like, who can you talk to who can help you make some of those calculations on like how much you can set aside for retirement and stuff like that.
And just to jump in, hi everyone, I'm Noelle. I work at Catch as well. The best thing to do, you know, for example, for you, Patty, is to maybe sit down with these individuals and say, you know, if you want to go and find a plan for you or your household, you go to catch.co/NCCA, and on that page will be the box where you can put the zip code in, and that will walk you through everything Kristen just showed. And if everyone does that individually, that will allow them to explore the plans for themselves. And then of course that will help them find if they want to create a retirement account, or if they want to start withholding for taxes. It's all within the same platform, of course, but it's catch.co/NCCA.
Could you say that slower?
Yes.
Please.
catch.co/NCCA.
And Noelle, if you would throw it to the group too.
Yeah.
That'd be great.
Yeah, I was going to throw it in there. It looks like I'm not able to chat to anyone but you, Diane.
Oh no.
Yeah, and mine's not going to you. I can't get it to her either.
Yeah.
Okay, you guys send me your information and I'll send it right to her.
And my email address, I can help folks route to the right agents. I think it might be Sam, who's in Pennsylvania. Noelle. Sam is great. Sam is on our team. He's awesome. He's so helpful.
Here's Kristen's, everyone. And
I'm feeling grateful I don't live in Pennsylvania right now and have to deal with this.
I mean, it's all the states in their own way.
Yeah, I'm glad we're able to help with Pennsylvania. My goodness.
Yeah, it's awful.
It's hard everywhere. I mean, it's too hard.
Yeah, it is. I mean, and I know Cindy started by talking about some of the advocacy pieces, but we at Catch are certainly, we are of the mindset that this health insurance system needs some work, and that this is not the system as it should exist. And our goal is to help people get through it as it is now. But our hopes and aspirations are that we are able to make advocacy changes as well, and to get a system that is a lot simpler. I think one of the biggest challenges is that it's just so complicated. So know that you're not alone there, and that this isn't something that having expertise on is like, nobody's born knowing this stuff, right? Like we've all taken exams to be able to know this stuff, right? So make sure you're getting help from folks who have that information, and we can definitely help you find those resources if it's not someone on our team.
Well, you've certainly enlightened me today, along with a couple of our, folks that are asking questions like Patty and Nancy. Just realizing, how confusing this can be, and that there is some expertise that can help navigate these waters.
Yeah. Yeah. And Meg and Patty, I took down your email addresses, so I'll just shoot you a quick email so you have mine, and you can just send me more info, and then I'll help route you guys to the right folks on our team.
And then everyone, I sent to the group, the catch.co/NCCA to get more information, and also Kristen's email address. So make sure to grab those before we get off on the chat side. Any other questions for Kristen and Noelle while we have their attention, or for Cindy for National Child Care Association?
Hello.
Hi, Gloria.
Hi, how are you?
Great, how are you?
I'm good. I called to say that I have been very much enlightened. I'm a provider, child care provider, and I've been looking for quite a number of years to find out how we could assist our employees with getting some type of health care. So I've got a lot of good information.
Awesome. Awesome. Well, thank you all.
So
Yeah.
if any of you out there have other ideas for us for things that we can, assist with, and find affiliate businesses like Catch to make your life easier, because, I've been in early childhood for 40 years. I was not a business owner, but I was a provider, and I managed for a business owner, and I approached my job every day like I was the owner. And I know I've walked a mile in your shoes. So there's a lot coming at us. And again, I'm thankful for the day that Noelle called us, and said, hey, we might have something that could help your folks. And I'm glad that we had some takers, and, spread it around. If it works for you and of others in your community, let them know what the NCCA is, offering, and what Catch is doing to help people, because if anybody needs help, it is our essential employees in this industry.
Awesome. Thank you all so much. It was so great to meet you for a little bit. I'll send a couple emails out and look forward to hearing from you.
All right. Thank you so much. And I'm sure we will touch base again at some point in our future and bring you back
Awesome.
for some follow-up.
Great. Thanks, Cindy.
Everybody have a good weekend. Have a safe weekend. And we do have a webinar coming up again next Tuesday. Normally they're every 2 weeks, but this one got pushed up for a couple of different reasons. So on Tuesday, and I have that date right, Diane?
Yes, ma'am.
And the topic is, I think, raving fans, creating raving fans. Something about, how to keep your parents engaged and happy, and referring you to others in the community. The presenter is Caroline Jens. She too has been an owner operator of childcare centers, and now she has a company called Childcare Biz, where she actually helps other owners be successful. And she's a really good speaker. I think you'll really enjoy listening to her, and probably walk away with some good ideas. So I hope you all can join us Tuesday as well.
Great.
Thank you all so much.
Take care.
Bye.
Thank you all. Have a great weekend. Let us know if there's anything we can do for you. Again, thank you.
Bye-bye.
Thank you, Kristen. Thank you, Noelle. Thank you, Cindy.
Bye-bye. Thank you,
Bye.
Diane.
Bye-bye.